I'm Dr. Angela DeRosa, and I'm an internal medicine health specialist, but my primary interest and passion in medicine is about hormonal health, not only for women, but also for men. But we're going to talk about men in another segment. But for you ladies out there, let's first talk menopause. A lot of people come into my office and they ask, well, isn't menopause a natural state of aging and that we should all go through it and not treat for that state? Well, I do tell them, yes, actually menopause is a natural state of aging, but the funny thing is, or actually tragic thing is that we used to die in childbearing back in the medieval times. And if we were lucky enough to survive that, they actually burned us at the stake because they thought we were crazy. But karmic retribution is always interesting because now women are living longer than men. So we got even with them ultimately. But when you talk about menopause, yes, it is a natural state, but it can cause a lot of problems for women, not only from symptoms, but also can lead to chronic diseases such as osteoporosis, prediabetes, diabetes, high blood pressure, and heart disease. So not only do we get those awful symptoms, but we can also lead to chronic illness. So the first thing we need to address is what are the signs and symptoms of kind of moving through hormonal deficiencies and ultimately leading to menopause, which is the actual retirement of the ovary. So first and foremost, the thing we start with hormonal decline is testosterone deficiency. That typically starts in our late 30s, but if you have genetics or some things that may cause a decrease in testosterone, such as oral birth control pills or antidepressants, you may start that sooner. But on average, most women start that process in their late 30s. So testosterone is actually really interesting in women, and most people don't even think about testosterone in women. We often think about it as just the hormone that men make. But on a day-to-day basis, the ovary makes 60% estrogen and 40% testosterone. So what does testosterone do for us? Number one, it is Mother Nature's serotonin in the brain, which helps us control our mood. So first and foremost, we might see apathy, irritability, lack of patience with stupid, and frankly, frank depression, anxiety, and in some women I've seen suicidal tendencies. The other thing it does is it helps with our libido. So it gives us that kind of groove and that fun thing in the bedroom that we like to have with our partners. The most important thing testosterone does, however, is it controls our blood sugar and helps us control weight. So for instance, when we eat a meal, everything converts to glucose. Our testosterone moves that sugar into the muscle where the muscle can burn it clean. That allows us to maintain our weight and also prevent prediabetes and diabetes, which can also lead to heart disease. So once we get through that testosterone phase, we then enter the estrogen deficiency phase, which for some women can last anywhere from 5 to 10 years. And on average, I'd say it's about 7 to 8 years, with the average age of absolute menopause being 51. The estrogen phase is hallmarked by hot flashes, kind of dry skin, dry eyes, sagging breast, skin starts to sag, everything starts to go south. The other thing that estrogen deficiency can lead to is the night switch, which can lead to anywhere from warming, having to kick off the covers, or leading to frank soaking the bed, and we have to get up at night, change the sheets, maybe even take a shower, which then often leads to insomnia, which only aggravates the mood disorders. Lastly, estrogen deficiency can lead to heart palpitations and even vaginal dryness. I can't tell you how many times women end up in cardiology's offices because they have heart palpitations, and that's frankly a very common symptom of estrogen deficiency. So if you're starting to have those symptoms, a lot of women say, well, how soon is it going to be till it ends for me? Well, on average, as I said, the average age of menopause is 51, but that can vary depending on the person. The hallmark of menopause is meaning no more periods for 12 months. Once you hit that 12-month period, you can be pretty certain you're in menopause. But if you want to be certain, come see us. We can definitely check your levels and make sure that that's actually happening through blood testing. But we also want to make sure that you're not suffering from any of the other symptoms from menopause, such as high blood pressure, checking your sugars, making sure your thyroid's correct, and various other things. But the good news is you don't have to live with all of this. We can treat you with proper hormone balancing, with bioidentical hormones and what we specialize in, and with pellet therapies. If pellets aren't right for you, we have various other things we can use, such as creams, gels, troches, and patches. The only thing I caution you is don't get stuck on those orals. Those aren't necessarily good for women. But again, if you're struggling with symptoms, please don't suffer in silence. We're here to help you, and we're really good at what we do.